no idea. I was expecting gray matter in one area, gray matter in another area. I would have been happy with a little blip someplace, but I ended up with two enormous tracts in the brain that were off, that were less dense, that were less well-formed. And it's connective tissue. It doesn't do anything. It's not a verbal area, it's not a nonverbal area, it's not a memory area, it connects areas. I couldn't get my mind around it. And then I had one of those lucky breaks that a scientist gets now and then. You know, I'm sitting there just out of my mind, not getting this. And then there was another paper that somebody passed me and it was on my desk. And then all of a sudden I stepped back and I saw the whole elephant. Now, the paper that I was reading was kind of a meta-analysis on its own. What people were asking, naturally, is what parts of the brain light up when somebody is sexually aroused? What are the sexually relevant parts of the brain? Now, what was interesting in that set of studies is that there is no one sex center of the brain. It's a network of several areas in the brain that seem to operate together. It connects the middle frontal gyrus is, again, the person essentially trying not to react while they're in the brain scanner. The area in the middle, the insula and opercula, are about sensory integration. The superior and inferior parietal lobules are about movement or about thinking about movement. And the occipital cortex is about vision. So if you put those together, those are just individual aspects of what a person in a brain scanner watching porn is thinking. Yes, the visual areas are lighting up quite strongly. The motor areas are imagining the interacting with whatever the subject of the film is. The sensory integration is, of course, the sensory integration, and the frontal lobe part, the inhibition.